Hello everyone, Dr. Kozer here, and this video is going to be covering the curl up. So the curl up is another exercise that we are going to use to re-strengthen and regain spine strength, spine stability, and reduce the likelihood of having low back pain. So we won't go into much detail about all the reasons why we should do it. Just know that it is another integral step in essentially re-stabilizing an unstable spine. And it could be from a structural shift, it could be from a car accident, it could be from any number of different things, but your spine is unstable, and we prescribe this to give you the best chance of stabilizing that spine so we can avoid other unpleasant things in the future, okay? So this one is a very simple, very basic exercise, but it is hard to do properly. So what I'm going to demonstrate is the perfect rep and essentially some downfalls and what some of the things that I see where it goes bad, okay? So the first thing is getting on a nice, stable, firm foundation. Now doing this in the bed is not recommended because the bed is too soft. I built this with a certain type of firmness. So this is essentially slightly less firm than a floor, a concrete or wood floor. So for those of you that are in too much pain to lie straight on the floor, maybe put a blanket down to try to help soften up the floor for you so that you can lay there for a couple minutes while you're doing these exercises, okay? So the first step is lying flat on your back. Well, I'll show you how to do this essentially as pain-free as possible. So as opposed to just rolling back like this into position, because that can actually cause you pain. Anytime that you have to round out your spine like that can flare up low back pain. So we want to get into position as pain-free and as safe as possible. And we do that by trying to essentially lay down on our side first without bending the spine. Get from essentially a seated position without moving the spine, looking like you are like a robot, and then lying down and then turning over and lying on your back. That is the most pain-free way that Dr. Stuart McGill found out how to get into this position. So the second step is placing your hands folded on top of each other like this in your low back. Now the reason we do that is because we want to make sure that our low back does not move during this exercise. The goal is to stabilize the spine. If our low back moves during this exercise, it is not stable. So this is called the curl up. So what we want to do with the curl up is have our feet flat on the floor if this causes you the least amount of pain. If legs lying flat makes you feel better, try that, okay? So it's whatever makes you most comfortable. So step one, get into this position as shown. Step two, place the hands in the low back. Step three, tighten every ab muscle that you have with about 10 to 20% of your maximum force. And then step four, we will perform the curl up. Now the curl up is not a sit-up. A sit-up has been shown to essentially damage the low back if you have an unstable low back. So what does this look like? Essentially, it looks like you're curling up a little bit. So just watch and I'll demonstrate. So what I'm doing is making sure that my abs are tight, my sides are tight, all of this is tight. Step two, what we're going to do is just curl up to where our shoulder blades barely leave the floor. So it'll look like this. And my low back did move and then back down. So I'm curling up, holding for 3 seconds, going back down. Now you see that's not a whole lot of movement, but it is enough to start retraining the body to move without moving the low back. So very simple. So I'll show you some shortcomings. Now, what we don't want to see is severe anterior head syndrome with this. So we don't want to see this. That is not a good rep. Your neck should not move during this exercise. Your neck should essentially stay attached here to where the only movement is occurring in your thoracic spine or your mid-back spine. So watch one more time. My mid-back is curving around the area of my shoulder blades. So step one, get into this position. Step two, hands in the low back. Step three, tighten the ab muscles. Step four, curl up. And if you notice, My head didn't jump forward or look up or drift off to one side. My spine went straight up, straight down. Okay, one more time. So if you feel weakness here, then that means that you do have that posterior translation issue with the spine, and it's usually results in turning off of all these vital neck muscles, which results in all sorts of chaos later on in life. So we want to work on those too. So how many of these do we do? Well, so like I showed you, we want to be able to do about a 3-second hold. That's mostly my recommendation there. We don't want the low back to move. We want to be able to do 10 reps. So the first set of exercises that you do in this series is the bird dog. So you'll do 10 bird dogs. Remember, 1, 1, 2, 2. So 10 bird dogs, 10 of these, and then the next one is called the side plank. So this is the curl up, very important, and it's another step in just being able to regain your pain-free life or get you as pain-free as possible, okay? So Dr. Kozer signing out. If you have any questions about how to do this, or essentially maybe some tips and tricks on helping if other things are hurting outside of your low back, just pull me or one of the CAs aside and we'll try to demonstrate it to you the best that we can, okay? So Dr. Kozer signing out, and may the force be with you.